Everybody. My name's Kevin Wood. I'm a medical oncologist and hematologist at Valley Mount Sinai Comprehensive Cancer Care. I focus in GI and head and neck cancers, but I'm here today to talk about cancer screening. So the first question is, why is screening important for cancer? Cancer is the second leading cause of deaths in the United States behind heart disease. And unfortunately, as cancers develop and grow in the body, they are typically clinically silent. And what I mean by that is usually patients don't have any symptoms and don't know they have cancer until it's too late. Thus, finding screening techniques are vital to identify these cancers early before they've spread and when they're still manageable. I firmly believe that cancer screening, in addition to living a healthy lifestyle, is the most important way for you and your family to live a long and healthy life. What is a screening test for cancer? So cancer screening tests are tools and techniques we have available to identify cancer early before it's spread to other parts of the body, or to prevent cancer from growing in the first place. We have a wide variety of tools available to do this. This can range from something as simple as a blood test, like a PSA level for prostate cancer, for a skin exam by a specialist, like a dermatologist for skin cancer, a mammogram or a colonoscopy, so a procedure or some kind of imaging modality, or something like genetic testing by one of our genetic counselors. What are the guidelines for early cancer screening? Breast cancer. So the average risk female has about a 15% risk of developing breast cancer at some point in her life. With mammograms, which is the best imaging technique we have to identify breast cancer early and treat it, we can lower the risk of breast cancer deaths by almost 20%. For cervical cancer, the Pap smear was discovered in the 1920s, so almost 100 years ago, and it's still the best tool we have available to identify cervical cancer. Currently, the guidelines recommend a screening for cervical cancer every 3 years for females aged 20 to 29, and every 3 to 5 years, depending on the test used, for women aged 30 to 65. For prostate cancer, the data is a little bit more confusing. So for men aged 55 to 69, one potential test is a PSA level, which is a prostate-specific antigen. This is a blood test that measures a hormone that prostate cancer cells can produce. If that level is high, potentially you may have prostate cancer that needs treated. The issue is the data suggests there's only a small benefit in prostate cancer survival with this test, but there's a high chance for false positives and overdiagnosis, which can often lead to a lot of anxiety for the patients and many procedures that aren't necessary and potentially harmful. So it's worth a thoughtful discussion with your primary care doctor or urologist before you order this test. For lung cancer, our current guidelines recommend for men and women aged 50 to 80 years old who have a history of smoking of at least 20 years and have quit within the past 15 years or continue to smoke to have an annual low-dose CAT scan of the chest. The data suggests it can significantly lower your risk of lung cancer death. For colon cancer, our guidelines recommend that everyone should be screened from the ages of 50 to 74. Colon cancer is the second leading cause of cancer death in the United States, and our tests are very good at identifying and preventing cancer from growing. There's multiple varieties of tests that you can consider. This includes a fecal occult blood test, a sigmoidoscopy, a Cologuard, or colonoscopy, and it's worth a discussion with your gastroenterologist to decide which is the best test for you. Though currently, if any of the tests except for the colonoscopy are abnormal, you automatically need a colonoscopy, as that remains the gold standard. Finally, for skin cancer, currently there is not enough evidence to suggest annual screening for skin cancer, though I think it's an easy thing to do to see a dermatologist once a year just for a good skin exam to make sure nothing's developing. Any further questions, please email us or visit us at our website.